So this is the time that we set aside for discussion, and this is always a pleasure to have at Population Health Roundtable workshop, because then we get to share ideas and share thoughts that help us to grow in our recognition of the issue. And so I'd like to just recap a little bit about what we heard from Kimberly and Jose Joel and Karen. And reflect on the fact that the common thread seemed to be human capital and social capital building. We're talking about these as if they are parts of an equity principle, or a principle of investment in human dignity in Manuel Pastor's parlance. We looked at the process of engaging young people so that they contribute to community health and well-being in constructive ways through growing awareness and building identity, providing skills so they could gain voice, and then move into leadership among their peers and in community, and creating very productive and worthwhile aims that direct activity at community improvement, these social aims that maybe have been lost for a generation or two, if you think back on Generation X or the generation lost or the generations before that. Those of us from the 60s remember what the social movements were about, but I'm afraid that maybe we've had some gap in generations since then, and rebuilding that has a worthwhile purpose. Also personal improvement, becoming personally engaged in healthful activities and healthful habits and behaviors that then rub off on family members and on younger siblings and on other community members as role models, and thinking differently, thinking outside the box, knowing that you can question authority as long as you're going to be constructive and come up with solutions too. In other words, putting people on a trajectory, young people on a trajectory, and seeing their trajectory be quite productive in terms of being able to give society the best of what they think. And then aiming at total population health in a personal and population dimension. Targeting policy and systems change and environmental change through programs such as obesity prevention or improving nutrition, physical activity, or transportation in communities. A very common theme, and it's something that we've found as being a positive outgrowth of the movement to prevent chronic diseases, is this community engagement and build out of new dimensions well beyond just preventing obesity. Seems to be a real gateway or a Trojan horse then to rethinking how we operate in terms of our lifestyles and the inputs that we have in terms of the trajectories that we set ourselves up on with youth. And so it opens ourselves up to the conversations like the one that we're having today, where we think well beyond just medical and illness conditions, but in terms of community conditions. I guess the main thing that we're hearing out of this, too, is that we're building people power. At least that's just what we call it at the California Endowment, where you build capacity. And I like the term about resisting marginalization, because that is part of this growth, and this capacity is recognition of who you are and where you've come from in the culture, in the society and the neighborhood that you've grown up in. And then aiming some critical analysis at that situation so that you can come up with something better than maybe what you have been destined for or have been born to, in creating a better society, a better place, better health where you're from and where you live, work, play, or go to school, through moral, ethical, and cultural grounding. And I think these are incredibly important when we talk about community. Again, reflecting on what Manuel Pastor had said, that we come to this conversation not as a blank slate, but bringing with us all of the traditions and learning and life's lessons and influences that come with us, and some of us with harder knocks than others, but certainly with a point of view that needs to be taken into account when we contribute to the improvement of community. So this rethinking, this strategic mobilization and advocacy of people that bring plenty to the table in terms of their own experience. And they come here to share stories and lessons, learn from each other, and I like mentor, because then that creates the opportunity for recharging the community, for regenerating a new pathway, catalyzing a new generation that is going to move to grow greatness. And I love that phrase, is growing greatness. I think that's the promise and the hope, that dream that youth bring to the table, and really the energy behind it that makes this kind of work tremendously exciting and gratifying to support, at least on behalf of a foundation, and putting our money into youth, because we believe the payoff is so great. So thank you for the presentation on all of this. And I want to now give an opportunity to those of you from our roundtable members, as well as the audience in general, to ask questions or give comments. Perhaps you might want to reflect even on the discussion that you had about who you respected or looked up to as a leader, where we had that opportunity earlier, or you want to ask questions of one of the panelists. So this is open to you. Yes. There are microphones. There's one over here. Can you use another one? Please.
Thank you. Dave Kindig from the Roundtable. I just want to make two observations. One is on the people power thing that you just talked about. I have to say that what we heard from the panelists, from Jose, and actually from our experience at Inner City Struggle last night, I mean, it's not only the effectiveness that some of these efforts have had in actually making policy changes, but you know, the degree to which some young folks like you are growing in leadership potential and for the future is just very gratifying. And actually, I don't know how many of you noted the note at the end of Manuel Pastor's talk. If it's really true that actually there are health outcomes attached with the learnings that you have in the social relationships that you build in these activities. I mean, that's even hard to believe it, that, but I don't know the work, and he's the expert. But I mean, that would be amazing if it actually had health outcomes for you as well. The other thing I just want to say, for something that Karen said, I've at least been struggling. We heard from Marshall Gantz in December about building movements and what that's all about, and classical movements, even what Manuel presented, there's like an enemy often, or an antagonist that you can you go up against. And our issues here that we've talked about, it's not that complicated. I mean, most of us are convinced that we've overdone it in health care, and that those healthcare expenditures have detracted from investments in the other issues, you know, like education and income and social support and the environment. But it's not, you can't say that healthcare is the enemy in that sense, because of course it's an important determinant of health and we need them as partners. But when you said, I really wrote it down, when you said the school, it's not the school that you're against, it's the policy or the program. You know, the sort of winnowing that down a bit might help us a little bit, at least helping me, in the way that we think about that complicated idea. So just some observations, not questions.
Thank you all for your presentation this morning. I'd be very interested in each of your reflections on scale. You spoke very movingly of you know, the communities and the you know, what arose out of you know, Watsonville and New Orleans respectively. And so as someone who comes out of a 20-year history in the labor movement of building, like, you know, massive movement to scale, I'd be interested in learning you know, as as Karen, as you represented, growing from, middle schoolers who were like, we want to keep doing this. What do you think about the number of individuals you've engaged, affected, and what, hope and opportunity this represents to, go to scale in, nearby communities, similar communities? Sorry, Lisa Hubbard from St. John's Well Child and Family Center. We're a network of nonprofit community health centers.
I'll go first, I suppose. So that's a really timely question, particularly for Rethink, because we have been approached by folks not only in New Orleans but Louisiana and different entities about sort of starting Rethink chapters somewhere else. What I've been talking to our staff and our Rethinkers about is about how we think about growth, and instead of growing wider, just growing deeper. And what we mean by that is rooting ourselves. A lot of what we're able to do is because we're rooted in a particular community, and so what we do is contextual. It certainly has, we can relate to what's going on in other places, but our effectiveness has been because we're rooted in a particular context. And so when we're approached by, someone who says we want to start a Rethink chapter in New Jersey, what we really try to do is figure out how we can come alongside and support whatever it is that they're trying to do without necessarily saying we're trying to spread Rethink throughout the whole world. But maybe there are some things that we've done that, and some lessons that we've learned that might be able to support what they're doing. And maybe there's something about what they're doing that might be able to enhance and support what we're doing. But we're really trying to make sure we stay contextually, we stick to what we're doing here at Rethink. And then also, when it comes to, this is the hard question, of course, is capacity. I think when we look at staff capacity, we're able to do some of the things that we do because we're very clear about the amount of Rethinkers we could work with at one time. We're building capacity certainly. A lot of our high schoolers are interns, so they're either interns or fellows, and then we have college students that come back and are interns. But we just want to be very careful of not growing just for the sake of growing. And by that I mean growing wider and sort of thinking about how do we grow deeper, and then how do we, in some ways, even though our Rethinkers a lot of times want to stay with us, to say that I think it's enough now, because Rethink isn't the only way. The way we approach things isn't the only way to approach systems change. It's one way. And so we're really even trying to support Rethinkers and saying, if you have a different way that you want to do it, as I mentioned earlier, is that they address things through first analyzing their educational experience, but you certainly don't have to stay within the system of education if you want to make changes. So supporting Rethinkers in doing other things that they want to do, whether it's they want to start their own movements or even their own nonprofits or what have you. And that's kind of more of what we think of in growth, and when it comes to growth, is how can we support other people doing different things.
I'm personally really glad you asked that question, because when I finished, I was like, darn it, I didn't say that. Because I did want to talk about scale, because my thoughts on that are, some of it's a matter of integrity for us, in that where the obesity rates are really high is in South County, and that's where the disparity is. That's where the inequity is more visible. And then there are pocket communities around our county as well, where you can see other health issues. But really, because we've been asked to expand as well, and we talk about it pretty often, but it's until we're really complete there, and I don't know that we should move too much in other places. And again, as Karen said, it's capacity. So because the disparity, countywide it's 30% our obesity rates, and then in Watsonville it's, hovering around 50. So, there's just a big difference. And so really continuing to infuse there and work there, and then expand. But with the Harburton Foundation that we talked about, grant that we received, the plan is that to work in other communities next year and to pilot our curriculum in 2 different communities or 3, somewhere in California, but we're really looking for partners to help us actually to figure out what communities have the most need and are similar to ours, so that we can really grow our curriculum in a way that addresses specifically what those communities need, because that's the tricky part as well. Just as Karen was saying, communities are different. So that's also partially our intentional naming of the curriculum Sanos, which is about health, because it will look different in every community. So our job, again, is just like for us to, guide our youth in identifying what matters to them, as well as Karen said, same thing. We have to, that's what we would do in other communities, guide them to figure out what theirs is. But we have certain tools and skills that we can bring. So it's something that is very important to us. It's something that we do want to scale up and continue to work with other communities. We want to switch the formula for that, and instead of saying, oh, we're going to write a curriculum and then whoever has money in communities with money and human capacity and individual capacity to buy our curriculum, those are the ones who are going to get the curriculum and help that we're developing. We want to get funding so that we get the funding to go to the other communities, and then we can help them so that the communities that are really in need get the help that they need. And that really is, aligned with who we are about equity and justice, that it's about finding where the need is and filling it. So I hope I answered that question.
2 important dimensions to scale that we recognize among youth is, one is trending, like mentoring, but very influential for younger kids, establishing, or even family members and others, youth, set the trends. People copy it and emulate it. And the second is use of social media. It's incredible how much influence that can have. And if you even question that, just go onto Facebook, go onto YouTube and see the number of hits that the statements or videos or stories that youth are posting about their own lives, about their own communities that are on there, and how many hits they get. It's in the millions. So tremendous influence for scaling up when you work with youth. Yes.
I did. Yeah, sorry. I couldn't figure out how to turn the microphone on. I'm Pamela Russo from the Robert Wood Johnson Foundation. I met you before, Kimberly. I had a question about when you mentioned the term restorative justice and the work of the Rethinkers. And yesterday when we went to the Inner City Struggle group, they also talked about restorative justice. And they actually had passed a policy change about willful defiance, which was something that was going on here. Kids could be suspended for acts of willful defiance. And it was interesting to me because the way they used the term was more like we're restoring justice, or we're restoring respect and dignity, which is different than how some, the people in the adult justice or incarceration community seem to use it. So I was curious about that. And then the second piece of that was when we asked them what they'd really like to change, what they were thinking about for this year, food. It was the school food. And, a guy showed us photographs of this, ancient withered grilled cheese sandwich that had been the last thing left on. But they said that when they had gone to the school to talk about it, they were told that the vendor's contract had already been made for that year and there's nothing they could do about it. So I'm curious if you encountered that in yours, and also how you, I don't know if restorative justice has come up in Sanos as an issue, but you mentioned it in New Orleans.
So restorative justice in the way that the Rethink in particular talks about it is sort of juxtaposed between punitive and restorative sort of discipline practices, particularly in school. And when we talk about thinking restoratively with Rethink, we talk about when a harm has been done, and harm has actually been done to the entire community. So how do we recognize what that harm has done to the entire community, and then come up with a way to restore whoever did it, when they recognize the harm, restore them back to the community. So there are various ways to practice it. Rethink is certainly not the only organization in New Orleans. The Center for Restorative Approaches does a lot of work in New Orleans, and we partner with them as well. So among young people, we do solution circles among young people to not only address the issue of the harm, talk about what it's done for everyone in the community, but also everybody comes up with a solution to how it can be restored, how folks can be restored, and then how we can address what actually happened. And then the Center for Restorative Approaches trains adults, particularly teachers and administrators, in restorative practices, so that when we work together in a school, we're working with young people to figure out restorative practices, and they're working with the adults and administrators so that overall the school policy around discipline is changed. And then when you mention food, definitely there are schools that we've approached that say, listen, we've already signed the contract with vendors. I guess the good and the bad, and there are certainly some frustrating things, definitely when it comes to New Orleans being a majority charter system at the moment. So the good and the bad is that each school makes their own decision about who they're going to use as a school, as a food vendor. So number one, we've approached the vendors ourselves. And that's been really great. Number two, we've had very good collaborative partnerships with both the city health department and with other youth in other schools. And when the rethinkers make their recommendations, a lot of times what we try to do with when the youth are making their recommendations, they're researching sort of the counter argument to the recommendation so that they're already ready with like another recommendation after that, if that makes sense. And then one thing that's been very powerful is that the Rethinkers, beginning in 2008, started putting out a school food report card where they graded every single school based on the health. It was like health, appearance, taste of the food that was provided, and that definitely put pressure on some schools because they had other young people sort of take surveys about the food, but they also had adults actually take the surveys, and they put out the school food report card and had a press conference afterwards and invited administrators to sort of make promises, invited them to make promises about how they were going to change the food. And this is where we talk about like understanding media. Like nobody is going to stand up in front of like all of these cameras or what have you and say no to a 10-year-old. Like nobody's going to do that. They might say yes and not do it, which is we kind of talk about that too with our feet to the fire piece, but nobody's going to say no to a 10-year-old. So those are some of the ways we kind of navigate that system.
So Thomas Levis, Johns Hopkins School of Public Health. So I had a chance to talk to Karen a bit on the break and ask her a question. I didn't get a chance to ask the other group the same question. I'd like to ask the question again and have Karen give that answer again so everyone else can benefit from it, but also ask you as well. And it was that in your presentations, you didn't talk too much specifically about how your activities have impacted population health, the health of your communities. I'd like to hear you kind of talk about that, whether there's a formal evaluation or even if it's just anecdotal stories about things that have happened that you think may be affecting the health of the communities.
I'll let you go since
Okay, sounds good. All right. So where to start? So actually, I think that's it's a great question because it, to me, opens the door for conversation about how are we measuring and how are we looking at success? And I think that, for example, it's important to look at individuals and to look at BMI, for example, and obesity rates and the like. At the same time, it's not the only measure of change that we can see. So for us, looking at our youth first and our individual youth and the youth that are working with their peers and their families. There's the changes that are happening with them and their influence. And then again, them as leaders, of course. Then we look at the built environment and the markets that we've worked with. So the markets, our recent market that was, covered windows, sodas, lining the walls, and just beer and cigarette advertisements and just, whatnot, unhealthy. And they actually already had produce in the store. And we were like, well, should we work with a store that already has produce? And we weren't really sure. And actually what has happened is that, the store is transformed. There's now, less soda, way less advertising. Healthy advertising is up. We've created a health zone with marketing materials that have bright, friendly colors that you can see throughout the store. There's healthy food at checkout with fruits and vegetables and honey sticks and bags of nuts and all kinds of things. Fresh fruit, cut and ready to go for kids to eat. We painted a huge mural on the front of the store, all fruits and vegetables. So that's, measuring those changes is, we've worked with 5 different markets, and they're not all the same. They're individual, so we can't measure that, in the same way. And, another one that's a bit controversial as well is our Healthy Options Ordinance, and then measuring the impact of that. So what was happening is when it first came out, people were like applying, because part of the ordinance had an award piece so that the city would award the healthiest restaurant with the Golden Carrot Award. And so that went well for a couple of years. And then, as I mentioned earlier, it started to wane, and that's when we needed to come back in. So that influence has been that, again, some initially of the first restaurants that came in were offering more healthy options and low-fat dressing and, whole beans. And, again, each restaurant is different. But then what we found was that it was not being implemented. People we surveyed, because we revisited, right, the ordinance, and one of our interns, which is another positive way to work with universities, the intern did her capstone project on the ordinance and found that most of the new restaurants in the last year or so didn't even know about it. So that was why we had to say, well, what are we going to do now? So, because again, it's our commitment, our integrity to what we're doing, and again, it's all of our responsibility. So, I'll just finish with that. It's ongoing, all of this, and so I hope I've answered your questions about measures, just to highlight some, but it's broad. One more thing. So when we were visiting some of the restaurants, we noticed that quite a few suddenly had signs up. We now have whole wheat tortillas, or highlighting their water or fresh juice, and they were making changes on their own. And so those are the things that they're not always associated with our work necessarily, but it's more of all of our work and the influence in the culture and the norms. So that's it for now.
Karen.
It's okay. I'll be super quick. So one of the things, I mentioned the school food report card, and one of the outcomes of that, and that helps us not only, after we do the press conference with the school food report card, we have our recommendations. We actually take down all of the promises that various administrators make, and that's why I mentioned feet to the fire. Rethinkers spend the next year kind of holding the administration's feet to the fire about particular changes. So one example is we gave an F to a particular school that shall remain nameless about about the food that they were providing, and they actually reached out to us and asked if we could help them figure out, number one, how to provide fresh food, but number two, they wanted to start a school garden that could help supply the food that they were going to serve in the cafeterias. So the Rethinkers that are part of the Food Justice in the Garden Committee actually is working with that school right now to build a garden and work with the young people at that school to learn how to take care of the garden. They designed an irrigation system. They did the whole dreaming process, designed the irrigation system, decided what they're going to grow. So that's just one sort of anecdotal sort of way of evaluating. The other thing that we do, we engage in youth participatory action research. Overall in New Orleans, there are a lot of sort of health and wellness indicators that are not the best, comparatively speaking, to other cities in the country. We have high rates of experience of trauma. Child Witness to Violence Project found that over 50% of children in New Orleans has witnessed violence or had seen a dead body at one particular point. We're talking about like mental health indicators and mental health issues. We survey our neighborhood to look at food access and food sovereignty, and there's a lot of places in New Orleans that can legitimately be called food deserts. So with our Youth Participatory Action Research Project, one of the things that we're doing in conjunction with the Institute for Women and Ethnic Studies and a couple of other youth organizing nonprofits in New Orleans is working so that young people can actually identify the indicators for their own wellness, so that we can understand what is actually happening on a mental health side with our young people. And studies have shown, similar to what Manuel said earlier, studies have shown that the process of being involved in organizing in and of itself not only has very clear health, but positive health results in terms of physical health, but also in terms of mental health. And if we look out of more of a, not necessarily a Western paradigm when we look at mental health, but I don't know if anybody's ever heard of psychology for liberation and the whole idea that in addressing what's going on internally, you have to be able to address what's going on externally. And the entire liberation praxis, when popular education, it talks about moving from being a subject to an object. So being able to act upon a particular situation, just that sense of agency and efficacy alone has proven to really help young people who are dealing with trauma to feel like they have agency to change a particular system or a situation. So, and then in the more kind of like paper, like real evaluation, the things that people want to see, data, we do evaluation after every single project and program. And particularly since so much of what Rethink does is based on participatory pedagogy, is that the youth design our evaluation before we go into something, and then they continually kind of like reevaluate during and then evaluate after. But we make sure that they're the ones defining what success is going to be, and then we really do put together a really robust evaluation after that.
So I think we're at the end of our time, and Mary Lou, do you want to?
Thank you, George. Thank you, panelists. That was a wonderful, inspiring session. I'd like to ask our second panel to come forward. This will be moderated by Kate Hess-Pace, the lead organizer for PICO Center for Health Organizing and the PICO National Network, and she's also a member of this workshop planning committee.